The start of summer can unfortunately mean an uptick in violence, and sadly, almost every morning we're reporting on yet another shooting that happened overnight. Well, now there's a new tool to track gun injuries in the district. As Jess Arnold found out, doctors hope the information will help the city put resources where they are most needed. And Jess joins us in studio now. Take us through this. What exactly is the dashboard tracking?
Allison is tracking all firearm injuries using emergency room data from DC hospitals. So it tracks more than just those shootings where police are investigating a crime. From firearm injury ER visits to the wards where our injured neighbors live, this data is being tracked in one place for the first time in DC on the Department of Health's new dashboard called FASTER.
I think it's important because not all firearm injuries are attached to a criminal complaint or prosecution. We have accidental injuries, we have unintentional injuries, so those were not really being counted because there's no suspect in that case. So I think this is a truer universe of the amount of gun injuries.
Right now, it shows an 18% increase in firearm injury visits from the same time last year, which surprised DC Health senior research epidemiologist Kenan Zamor.
It's cause for concern, and it's also cause to unify in how we're going to deal with this problem.
That increase lines up with what trauma surgeon and medical director for Washington Hospital Center's Community Violence Intervention Program, Dr. Erin Hall, has been seeing.
It is always tricky to ask a trauma surgeon, how busy you are. I do have to say that the pace has felt unrelenting this year.
This new data, though, has helped them better prepare.
It enables us to change our workforce to ebb and flow with when the most likely time for the most amount of gun injury or firearm injuries appears. And so we've been able to up staff during the afternoon, for instance, and early evening.
Both hope in the long run this new info helps inform change.
My goal is really just to address trauma at the community level.
What I'm also very excited about is in the future, how can we see that we're actually making an impact? Because I think with so many of these interventions, we want to be effective. We want to make sure that we're delivering on what we think we are. And the only way we can do that is with accurate data.
We know even one shooting is way too many, so I'm happy to see this being enacted. But I'm curious, are there any gaps in this data or other information they're still hoping to collect?
Yeah, I had the same question for both of them, and they both agree that one big piece of missing information is how many times the same person is coming to the ER with a gun injury. Violent injury is one of the biggest risk factors for another violent injury. Now, Dr. Hall says that is the bedrock of these hospital-based violence intervention programs. So once we can monitor that across hospitals, we really have the best shot of preventing an injury from turning into a fatality. Yeah. Allison.
All right, and may this never become just normal reporting. Jess, thank you so much.